This research project is under the auspices of the National Science Foundation International Research Experience for Students. The project seeks to develop case studies on how technologies are implemented in resource-poor settings in the world. In sub-Saharan Africa, where Uganda is located, the need for affordable healthcare services is critical. The current health statistics are not encouraging. First, the primary challenge is the lack of well-trained medical professionals and facilities. Second, sub-Saharan Africa epidemics vary significantly from country to country in both scale and scope. 9 out of 10 malaria deaths occur in sub-Saharan Africa. The socio-economic impact of this situation is felt across sectors of activities: agriculture, education, industry, transport, and human resources. On the other hand, there have been tremendous diffusion of mobile phones in sub-Saharan Africa. Our attempt to investigate how mobile phones can be used to help development begins by studying the use of mobile phones in healthcare in Uganda. The research is managed by the Southern University's International Center for IT and Development and the Makerere University Business School, Uganda. The project under study is the AppLab Uganda Project. The AppLab Project, also known as the Application Laboratory Project, is an initiative of the Grameen Foundation, Google, and MTN Uganda. These partnerships have been working together since September 2007 to build physical, human, and technological infrastructure needed to support the initiative. In Uganda, the AppLab runs the Health Tips application, which educates users by answering common questions about sexual and reproductive health.
I'm Francis, the AppLab project officer. Essentially, the partnership that Richard has talked about, which involves MTN and Grameen Foundation, has been in existence for about 6 years now. And this partnership came into place when we initiated the Village Fund initiative here, and that was about 5 years ago. But as we saw an evolution in the technological space, we realized that the Village Fund operators needed to find a new level of business. So we had to think of how we can lift their business aspects. So that's when we thought of helping them sell data services, and that's the reason why we started the AppLab project. AppLab is basically applications laboratory, and our main objective of being in place, or what we do, is to think of applications that can help people easily access information using the mobile technology. Some of the applications that Richard has talked about, that is the first suite of applications we built, which we launched last year, Google SMS. I will not repeat what he said, the composition of Google SMS as a product, but we also have a lineup of other application ideas that we put together. And all these are aimed at helping people, especially those at the bottom of the pyramid, who do not easily have access to all information channels. People who do not easily have access to newspapers, those that do not have access to television, or all sorts of sources of information. So that is our primary target. Though you will find that, as maybe from our discussion, you realize that most of the users, we do not have boundary between rural and urban. So despite the fact that our primary target users are people in rural areas especially, we cannot demarcate the usage of these applications. So we are keeping it to anybody who has access to a mobile phone. That mobile phone or the mobile device is our primary channel to market the products. But we're also looking at other channels like voice. We're thinking of developing applications that people can access the information via voice, like IVR, call centers and things like that.
Maureen is my name. I'm a proud mother of two. I work. I own a mobile phone, which I have had for over 10 years. I like Nokia because their chargers are usually available. Yeah, I have heard about it and I have used it for some time to get information. Being a mother, I'm so tied to my kids and I would want information about how to take care of my kids, how to feed them. So I usually get information about what foods I can give them, and I'm also breastfeeding, so I already want to get information about the kind of food that I must eat, because the quality of milk, breast milk that my baby can feed on depends on the kind of food that I eat. This kind of service is very good. However, it gives information that is a bit general, and I would like to have information that is a bit particular. For example, I would like maybe after they have given the message, and they would give maybe a contact of a clinic, a children's clinic, or a pediatrician. I can contact for more info.
Well, we piloted this, specifically the health application. We piloted it in 2 areas. One of the areas was one of the universities in Kampala. That was Chandigarh University, because we realized that most of our target users are within that age group. So we had to make sure that we pilot within an area that has one of those, and that was the university. Then we also piloted in one of the local villages, somewhere not far from Kampala, but remote enough for us to give us good lessons on how the uptake of this application would be. We did that for about 6 months, and within 6 months we saw, well, the service was free by then. We were able to see about 2.8 million hits, the SMSs, through which people were testing the service. And we also did the pilot through intermediaries. We had people who were going out to help the users, tell them about the service, answer their queries, give us feedback. So it was, a whole setup of, networking between ourselves through the intermediaries up to the end users. We're still in a learning, phase. Okay. When we developed this service, we realized that people needed, once we did the needs assessment on the baseline survey, we realized that most people would love the service in their local language. But as you know, the challenge there is the computers do not understand my local language, neither do they understand this local language. So we must structure the message in the local language in a way that people will be able to understand it, as well as the technology to accommodate the local language. So it was a challenge for us. That's why we started with one local language in Uganda, the Uganda language, because it is widely spoken. Now, things like misspellings, yes, we took care of a number of misspellings. And not just misspellings, you have to think of the common words people use. For example, if I use your example of Edwari, you may find that in certain communities it's called something else. You may find that in certain youth groups it's called something else. So we have to pull all those, whatever we think that people use, and input them into the system. So misspellings, common words, different synonyms, different names of certain diseases, and because, for example, AIDS, SIDA, returning inappropriate responses. That is right. It can be maybe out of the keyword, It may be out of a misspelling that we didn't think about, and it's not in the system. Okay, so that could be possible.
Can I give you
so
an example?
The computer, let me call it the computer, because that's the common explanation we give people.
Yes.
That it may look for the nearest word next to what it thinks you intended to, find out, and then return something. That's why you realize that at the end of the message, we put tips, and they're not the leads that if this message is not what you are looking for, type maybe reply 1 for ABCD or reply 2, so that at least will help you to get near to what you tend to find. Yeah. As you'll note in this partnership, Grameen's main mission is to help people lift themselves out of poverty, and they're doing that through technology and microfinance. Those are the two major sectors they support. Now, Grameen is a non-for-profit organization. Now, they are not interested in making money out of this, but they are interested in getting people access information, useful information that can transform their lives. Now, when it comes to MTN, in as much as it would want to support on the same front, build applications, create more value for people with handsets and telecommunication services, they would also want to make a little buck, okay, out of the investment. Now, MTN has the commercial aspect, okay. Now, back to your question, did we consider other networks? Yes and no. Yes, because we want to make money out of the SMS you send, okay? But at the same time, we think that once you get this useful information, you will you will disseminate that information to your peers. Secondly, for MTN to be looked at as an innovator in the market, then it means we're encouraging, in as much as we're making money, but we're also encouraging new connections. So if you find that there's value, there's more worth for you to be connected to MTN, then I'll be forced to get connected to MTN so that I access the same service. There's a lot of politics involved in this. When the partnership came into being, actually the partnership was between MTN and Grameen. But Google approached, because Google was looking, actually up to today, they're still looking for a way of reaching people at the bottom of the pyramid, but with services that we all pull from the internet. Okay? So that's why, like the general search, you may search for international news, everything via SMS, but this information is coming off the web. Okay? Now, Grameen, of course, with the innovations around the village phone, Grameen was one of the easiest targets to work with, one of the easiest partners to work with. So Google came in, and of course, as we all know, Big Brother, with a big bag, they just pull the strings and you dance. So when Google came into place, they put in a lot of investment, and by the mere fact that they are owning the technology of this, which this service is running, they had to make an impact. How best would they make an impact? How best would they make people aware that yes, Google has a footprint here? It was by owning the name.
Branding it.
Yeah, branding. We've put a proposal together for a service, rather a call center, and that call center specifically is going to address things like that, where people cannot find enough information via SMS. They should be able to call in and get, ask any sorts of questions. And we're also looking at, getting the service out of, through IVR. But we know our weakness, the general weakness with our people, talking to machines. People don't want to listen to machines. They don't want to talk to machines. It's a challenge. It's a culture we just have to build. We must nurture it up to a certain level. And as we see, the development in the technological space, as I say, people must have to jump on this bandwagon of data services. They must jump on the bandwagon. Otherwise, they'll be left out. Because if you look at the phones, 5 years ago, not so many people had phones with cameras. Actually, those were the the rich people. Okay, but now each phone that's coming out of China has, you can access the web, video, you have. So people must, be helped to transform, with the technological advancements, and that's the only way we want to get them to appreciate. When we were doing research before we started, deeply thinking about this application, we went through all the government bodies that are responsible for the health sector. But that was one of the main areas they emphasized, that we should not attempt to give prescriptive information. Otherwise, people will end up doing self-medication, and many of them will die. Like he's saying, personally, I don't know how many times I visit a doctor for a checkup, and I know it's very important and critical for my life, but I ignore it. Now, if I have a phone which is going to tell me, give me prescriptive information, then it means I'll become a doctor myself, and we didn't want to turn people into medical personnel. Because whatever source of information will pull this content, it must be verified by the Ministry of Health people. The way the system is set up, we think a lot about confidentiality, the user confidentiality. We cannot, for example, if you send out a query, we cannot know. We may see your number. If we see your number, then we can't know what you're querying about. If we see what you're querying about, then we can't know your number. Now, as MTN, we see the numbers, the phone numbers of the users, so we have all these statistics. We know at what particular time how many SMSs are going through our system, linking to 607, but it cannot separate between health and agriculture, so we just see the shortcode.
Straight Talk here is one of the local partners that works on providing content for the Google SMS healthcare and clinic finder tips. So I'm going to just hand over to Irene so that Irene explains to us on the role of Straight Talk in this project. So you can introduce yourself, Irene.
Thank you very much. My name is Irene Kitui. I work with Straight Talk Foundation as the content manager for Google project. It's the project that we took up. At first we used to partner with AppLab just to give them content, but now we are the people managing the database. Now, Straight Talk, I'll say, why did we join? When AppLab came to Straight Talk and said they're going to do something with mobile phones and people can get information on their mobile phone. At Straight Talk, we decided to join because we knew this is where the world is going. We are going technology. We're not going to remain behind. And we said, well, if our target audience, that's young people, empowering them with information at their hand tips, that would be very, very good. So we welcomed AppLab and said, fine, if there's anything we can contribute, just come to us. Now,
when was this?
The project started 2 years ago, but officially it was launched last year in June. Now, before the launching in June, we used to work with AppLab. They would come to us. I'll give a background how it started. They came up and said, as Straight Talk we have programs. We have radio and we have print. And young people always write to us. So they came and said, can we get some of the questions that these young people are writing so that we can give them answers? Now, when we looked at the questions, we came up with categories under reproductive health. And those categories were HIV, we had sexuality, we had maternal health, we had STIs, sexually transmitted diseases. Yeah. So after putting them in those categories, we said, now let's generate content, every content that we can get about this, and all the questions that we could imagine. So basically, it's our questions that triggered which topics should we really focus on. Yeah, because we're looking at the letters that we get from young people. Now, after that, in June, it was launched officially, and after our launching, AppLab gave the project to Straight Talk to man it. Before it was at AppLab, but now it's really being run at Straight Talk to make sure we have this content. But with time, I'll say the trend has changed. When we started, we thought we are going to concentrate on reproductive health alone. But when Google went back to look at the failure, what are the questions that people are sending and they're failing, we realized people are not asking about reproductive health alone. People are asking generally. Somebody is asking about diabetes, somebody is asking about asthma, somebody is asking about stress. So what did we decided now, let's change, because we want to give service to the people. You know, if you have put diabetes and it fails, and the next time you put stress and it fails, I don't think you'd want to come back again and ask. So we decided, let's put all the health information so that if somebody gets a question on diabetes, they get a response. And if they put a question about reproductive health, maybe about HIV and what, they still get a response. At least they'll be tempted to go back and access the service again because it's providing them with information. So that's how we are so far. We have now expanded from reproductive health to health generally. So far where we have reached, we can't say we have all the content. No, we are still adding in content. And your feedback is really something very important because we are looking at making sure that people get the services. I can't say we have all the content. We are still adding more content. That's why you see we are still working day and night to make sure that we have a lot of content. And what the other thing I want to say is health trends change. And that's the fact that we have to know and we have to keep thinking. I always tell people, I think 20 years ago, no one knew, maybe 10 years ago, no one knew that a mother who is positive would give birth to a negative baby. But now it's happening.
It's true.
So I think information about health keeps changing. The trends keep changing. We don't have fully the database, but we shall keep adding. So that feedback is really very important. What I have to say, the way this works, technology is, it looks for the keywords and then sends back to you. I'll give you an example. When we were starting, we had a lot of failure rate. Why? Because Ugandans are used to asking a doctor or something. Yeah. So people would start, hello doctor, I have a problem. I think I am having PAS. So the system would fail to pick the right trigger words, and then it would always pass straight. Yeah, pass straight. It will give you the right information. So basically, we are still trying to. I'm not saying we are really very perfect, but even the failure rates help us to go back and say, now why is this failing? Can we change this and this and the other, and then we make it perfect. We say Google. This project has different partners, and we all have our own roles and responsibility. Now, as Straight Talk, our role is to make sure we have content. Content is generated and we have it. Now, as we have content and put it somewhere. Now, if Google doesn't come in to make sure that the content goes into the technical bit of it, then we shall have content with nothing. So Google has the technical bit of it. And then MTN is the source where people have to access the SMS from. So you find that all the different three partners are strong. You have a backbone. You might be a backbone, but you can't do without the other. We can have the content, but if without Google, then the content is useless. I did one time. I was doing a survey somewhere for another organization and said sometimes it's not good to pay somebody, because when you give them, if they are given 10,000 today, in the next month 10,000 will not be value. They will need 20,000, and I would think with information, with especially the health information, I don't think we should buy somebody to ask. It's like I'm buying you to participate in the quiz. When the quiz ends, what next? Yeah, I think that's good. It's something to think about. But I also want to say, you and me can afford to go to internet and you know, for example, when you put internet, Google, and you put malaria, it shoots you with so many things. And if you're not brilliant enough to say, now this is exactly what I want, you can end up getting messed up and you really don't know. But the advantage with the SMS, where we want it to be, is if somebody asks for malaria, it is malaria. Okay. If somebody asks for malaria in pregnant women, it's malaria in pregnant women. Strictly that. So I think yes, it might be a competition, but there's one side of advantage is you know, when they give you with all this information and you have to choose which one I want, I think you would rather go for the SMS. Yeah. Where we translated the database for content generation, we have two databases. For Clinic Finder is a different database, and for content. So content was translated. Now, because of a high rate of failure and so on in Uganda has been stopped. We are not translating anymore. And two, because Google is going to market this product in other countries, they are going to put only one language, English. So they don't want, because like I told you, this was a pilot. They don't want a scenario where they go to a country and say, we want content in health, and people say, but in Uganda you did Luganda, we also want this. Let me tell you, now, here, yes, as we talk, it's normal. I'll give you an example. I know the person who is a Msoga, and no matter what you say to them, you'll speak your Luganda, but they will speak their local language. The problem is in Uganda we don't have one language, one common language. My mother can't read Luganda, but she can read English. So this is a scenario where we have over 50-something languages. So it's a battle around. I come from Eastern, and when you speak Luganda, everyone looks at you like, what's wrong with this one? Yeah? So that happens. But if we were in Kenya, yes, you can say we can do concurrently English and Swahili, because Swahili is a strong language. It's a national language, the second national language. But if you ask in Uganda, what is our second national language? If you say Luganda, they can skin you up. And Teso will say, Luganda? No. You know, we have not reached that stage yet, because I would say managing the database is something not easy. So connecting the tip to a clinic is not something that we have ventured in early. But what I would say is, in every of our tip, we tell you to rush to the nearest health unit to you. So that is the farthest we are telling people. So we are telling somebody, if you see this and these signs, it might be maybe an STD, and the effects of not treating an STD is this. So if you see any of the above signs, rush to the nearest health unit for diagnosis and treatment. Yeah, because we're not really basically giving, because we have to put that into our triggers, and it has to be one of the keywords. So we have really not ventured into that yet. But I think we are doing a lot of referral in the content itself.
Well, my motivations are always to just learn as much as I can in general. But this experience presented the opportunity for me to travel abroad and just to experience life outside of what I was used to, things that are familiar to me, and again, just a learning experience holistically, to learn about not only the things of this research, but other people and their culture and their way of living.
My motivations for joining the IRIS program was to gain not only a cultural experience, but academic understanding of how the world works. For example, learning more about mobile technology and how it helps resource poor countries.
I joined IRIS this program because as an MBA student, I would like to know the different culture and work with different people. It will gain my different experience, and I believe it will gain more knowledge and open my mind to build a global view. So that's why I joined this program. And also the other reason is also I'm a person, I would like to meet different people and learn different culture. So that, because I'm original from Taiwan, so it's also the other reason I would like to pursue my MBA in the United States and do more global research in different countries.
This project consisted of learning about Uganda and its use of the mobile phone with Google SMS application. What this project focused on was the deficiency of healthcare information in Uganda and how Google SMS could help implement a solution to create awareness and education for better healthcare.
We interviewed with 149 students in the campus, not only the students, but also the instructors. And we learned from, there's an interesting factor is the majority of people, they using Nokia as their first choice to a mobile phone. And they also use Samsung and maybe Sony Ericsson. And a lot of people, 90% of people, they choose pay-as-you-go for their service. And there's only 7% of people, they use contracts for their service. It's quite different in United States or in Taiwan, because maybe some interviews they mention because pay-as-you-go is more cheaper and maybe they have more discount for them. And also there another factor I learned is the people here, they would like to share. For instance, like the 149 students that we interviewed, everyone has one cell phone. But maybe their friends or their family, they don't have cell phone, but they would like to share their mobile phone to their friends or family whenever they need cell phone. So it's quite interesting for us. And also we learned that the majority of people, when they use a cell phone, the most function they use is text message. And the second popular function is voice call. And then is calculator functions. And the internet is only maybe 50% of people that use internet with the mobile phone. It's also surprised me because, like I say, maybe in Taiwan or in the United States, everybody uses a cell phone. But the primary function they use is voice call and then text message. So it's quite different. But as I say, we learn a lot from different culture and different people use the usage of mobile phone.